पैथोडीन अगर आपने दिया
पैथोडीन नहीं,
one.
हाँ
किंग्स और डोमियो,
किंग्स
किंग्स 1 cc और
1 cc
साथ में आराम से
No surprise attacks.
Yes, sir.
बियर के ग्लव चाहिए और डायरेक्ट करेंगे?
Okay, drop the scope. Have you told him what you're doing?
Yes, I told him.
Okay.
Yes.
I didn't hear.
Are you happy?
Happy?
Happy.
Is he happy? It's very hard for the guys because they see themselves on there, get very nervous. It can be difficult. Then they've got some geezer like me stood here and they look a little bit, whoa. So tube going in, my friend. Always tell him what you're doing. Tube going in.
Yes.
Tell him.
हम शुरू कर रहे हैं, ठीक है ना?
Good. So what are you going to do?
Deep breathe.
It's too soon to deep breathe. If he deep breathes now, you've done it wrong. Ooh, this gone in. So, don't advance. What can you do? A little bit of air. A little bit more. Good. A little bit more air. Air. A little bit of air. That's suction. Good. Right. Find the lumen. So where's the lumen? You need to tell me. Where's the lumen?
It's right side, clockwise.
Okay. Good. So where's the lumen? Where's the lumen?
Central, lower end.
So think of 12, 3, 6, 9. 12, 3, 6, 9. Where's the lumen?
Set 9.
Excellent. Good man. And so what are you doing there?
Anti-clockwise.
Excellent. And why have you done that?
To get the center of the lumen.
Good. So to bring it up to where? 12 o'clock? Or don't fish, slow down. Look at the folds and they're telling you which way to go. So which?
It's 9 o'clock.
Okay, step that way. Allow this to come here.
Yes.
Now where's the lumen? Hold the scope. Now where's the lumen? 12. No, up. That's it. Good. Hold the scope. There. Where's the lumen?
It's 12 o'clock.
It's roughly around 10 at the moment, so a little bit more anti-clockwise.
Yes.
More. Anti, that's it, and clockwise comes in and it takes it forward. Keep the scope straight. Ooh. Sometimes what happens is that when we get very bad bowel prep, we have to make a decision, should we continue? Have a look and see if this clears, if it continues to be bad. But the thing about this motion is what? What does that stool tell you?
The blood is not active blooding.
You're not seeing any active bleeding at this present moment in time. So it was normalish colour, unremarkable. Okay. So where's the lumen?
It's 11 o'clock.
Good. Keep hold of your scope. keep hold of your scope. Drop your hand. Okay. What you're doing is just you're moving the wheels up and down,
Yes.
and then you're moving the scope. One thing and one thing only, and whatever you're going to do it slowly.
Okay.
Okay. Start again. Clean your lens. Don't suck. Clean your lens. That's it. Now clean your lens. Don't suck. Clean. I'll turn the suction off. Clean your lens. Good. Good. Clean your lens. Keep it pressed. Keep it pressed. Press. That's cleaning your lens, okay? Anti-clockwise. Good. Keep it on. So bring the hand down and advance. Good. Clean your lens. Don't let go of the scope. What are you doing? That's good. Don't suck. Good man. Advance the scope nice and slow. Advance the scope. We've got an algorithm. Is the patient comfortable? How do you know? Just because he hasn't said anything,
Yes.
he might have the highest pain threshold in the world. Is he okay?
Seems okay.
Well, what are you going to do? Are you going to ask him, or are we going to put our hand on his brow and guess? Ask him.
तकलीफ तो नहीं हो रही है?
Is he happy?
He's saying no. Yes, he's saying I have no pain.
Okay. Slowly. 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 Good. Now, how are you going to turn into this? That's it. Just relax the scope in the right hand. Advance. 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 Now, let the scope relax. Let it relax. That's it. Big wheel. Draw the big wheel back. Back. Put that hand back on the scope. And turn this back here. Keep it going. A little bit of air. And look up. That direction. A little bit of air, and that's it. And what you want to do is go, slow your movements down, my friend. Slow it down. Right, you're fishing. I can always, fishing means is that you're looking for it rather than knowing where it is. Relax. Let go. Let go. Now you can see where to go. Now you can see where to go. See how that happens? You just relax and... Right, stop blowing, because this makes this bend very acute.
You like coffee?
No, I'm fine at the moment, Eric. Fine.
Fine.
Happy.
Happy?
Happy, happy, happy. Don't look at this. Look at this. Right, so what are we going to do? See, this is snake charming.
Yes.
So what are we going to do?
Maybe change of position.
Well, we could change position. 2, is he comfortable?
Yes, he is. That's right.
Okay.
He is comfortable.
Just advance the scope 2 centimetres. Draw the big wheel back a small amount. So pull the big wheel back. Go on. That's push. Pull the big wheel back. More. That's it. Allow the clockwise torque to come in. Just a little bit. Blow. Blow water. Blow water. Keep it pressed. 5 degrees of anti-clockwise. That's enough. Advance. Advance. Go on. Advance. And clockwise. There you go. Now, anti, take your shoulder back, anti and pull. Anti, pull, big, keep that big wheel back. Good. And now a little bit of clockwise and pull. Slowly. And now anti. And pull. Keep coming. Pull, not advance. Hold. Look at the screen. Big wheel all the way back. Is it back?
Yeah.
And now re-advance. That big wheel wasn't back. That wasn't far enough back. Now advance. Stop sucking. Keep going. Good. Keep going. Good. Good. Slowly, slowly, slowly. 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 Good. Right. Hold. And keep it on. Keep that all the way back. That all the way back. Slowly. 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 Just a little bit there. That's good. And slowly keep it coming back a bit more. And now keep that torque on.
Yes.
And now re-advance. Keep that torque on. No, you've took it off. You actually took it off. See that? You took off the torque. Okay? Advance. What I'm trying to do is get you to reduce without actually causing discomfort. Keep going. Keep going. Nice and slow. Nice and slow. Advance nice and slow. Finger away from the blow.
Yep.
Finger away from the blow. Keep going nice and slow. Nice and slow. Nice and slow. Good. Nice and slow. Take yourself around. Turn yourself around. Start with your thumb around at 6.
Okay.
Slowly, 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 slowly. Keep that on. You're trying to take it off. Keep it on.
Yes.
Keep it on. You have to keep. That's what I'm saying. Good. Off, on, off, on, off, on. Relax the wheels. Off, on. There we go. Little bit of air. Little bit of air. That's suction. Little bit of air. Hold the scope. You've got the scope. Good man. Good. It's below you. Hand needs to be here. Good. Because when you have your hand so far back, you lose the ability to talk. Okay? Good. Clean your lens. Don't suck. Clean your lens. Clean your lens. Good man. No. Right. Just pop the scope there for a second.
Yes.
Pop it down. Pop it down. Pop it down. Right. What you're doing at the moment is you're moving the wheels
Okay.
everywhere.
Okay.
Just stand there for a second. Right. What you've got to do is just calm down. All right. So we're here. As you come back. And what you're trying to do is here, back, here, back. See? Little wheel neutral. Here, back. And what we're seeing is bad prep, clockwise torque, big wheel is there, neutral. Let the scope go round. You can see where it wants to go. So this is where you were. I've just cleaned the lens, okay? Now he's going to feel very uncomfortable because a lot of air's gone in here now. Okay, now we just draw this back, and this is where you were. Draw the scope back and let it now go forward. This is what I keep asking you to do. Keep this torque on. You're letting this torque go, and then you lose the ability to allow the scope to go forward. This, you need to keep this torque on. Right? So we're here. Allow the scope to come back. Anti-clockwise, clockwise, anti-clockwise, clockwise. The lumen is at 9 o'clock. This is where you were 2 moments ago. See there? See how the lumen is? Big wheel, little wheel is off. This is where we want to be. And as it goes round, we just wait. And this is the hard bit where you just wait. Wait, 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 and wait. Increase the torque. Wait, 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 and allow it to go. All we're doing is just waiting. Now a little bit of air, clockwise torque, and let the scope come back. Now if you follow that thing, you'd be worried about where you were, you'd be worried about what's going on. Anti-clockwise, clockwise. Now the lumen is here. Back again to where that is. And we're just letting the scope go. And I just wait.
Yeah.
Yeah. Now what we've done, now this prep is not that good. Watch what I'm asking you to do. Okay, the scope is here. Clockwise torque, anti-clockwise torque, clockwise torque, anti, clockwise, anti, suck, 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 clockwise. See the scope? It wants to go forward. See the scope? Wants to go forward. Anti, suck, 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 suck. Suck, suck. I'm just watching what the mucosa does now. See it? And let the clockwise come in. And what you're doing is keeping the scope under control all the time. Okay? No, don't come back. Clockwise. Come back. Now, where are you going? Get your lumen. Don't come back. Look for the lumen. So what you need to do is just let the scope look for itself. A little bit of air. Now you can see. A little bit more air. Good. A little bit more air and come back. Just a centimetre. That's enough. Now have a look to the anti-clockwise. Touch the air. Touch. Now come anti-clockwise. No. What you're doing, if you look here,
Yeah.
you're allowing the scope to bow.
Okay.
And you're thinking it's going in, it's not going in. And what you're doing is that, so stop again, just have a stand there a second, let me show you. Right, so we've got the scope, wheels are neutral,
Okay.
wheels are neutral. Here is the scope, here is the lumen. See the lumen? Good, good man. No, just don't advance, find the lumen. Clockwise, big wheel back, so draw that, no that's forward. So tip up to you, a little bit of air. Right, big wheel forward, okay? Big, okay, stop. Okay, put the scope down a second, put it down. Right, what you're doing with the big wheel,
Yeah.
okay, is that you go in from here to here to here. Let me show you, and then watch what I do at the big wheel. See the big wheel? My thumb is on the big wheel. Watch. Thumb is on the big wheel.
Okay.
How far have I drawn back that big wheel? How far have I drawn back that big wheel?
Maybe inches, 1 or 2.
Maybe that. And it's not actually caused an effect on the scope. That's what I've done. Whereas you're pulling the big wheel all the way back.
Okay.
You don't need to do that. It's
Okay.
small movements, my friend. Okay? Watch. You're here.
Yeah.
Tip up. So big wheel back slowly. Big wheel a little bit further back, clockwise. See? Slow your movements down. One or the other. Slow down. Slow down. Slow down. Huh?
You want to say that?
No. Sorry? You happy? Okay.
Yeah.
Yeah, keep going. Slow down. Slow down. Slow down. You're a big man and you don't want to move. Come on. How was that?
It's okay.
Now, come this way. You're a big man and you don't want to move. You're a turn. No. What's yeah. Don't touch with your right hand. So turn, no. Turn the scope. See? Turn the scope. Good. Turn the scope. Now, tip up. Slowly. And again. More. Tip up. Draw it back if it's stuck, because it's under a fold. Off, on, off, on. Now, there you go. And now turn your shoulder. Good. And tip up. Good. Excellent. Tip up. A little bit of air. Good. Now, draw the scope back a centimetre. Let the big wheel relax. So neutralise slowly and then increase the torque. Go on. Go on. No, that's off. I want you to increase the torque. That's it. Big wheel back slowly. Slowly. There. It's down. Good. Turn to face me. Allow the scope to turn to face me. Good. Don't advance. You're desperate to advance.
Okay.
You're desperate to push. Is there somewhere to push to? Is there somewhere to advance to? Can you see where to go?
No.
No. So why are you crashing into the wall? Come back, my friend. Good. See it. Now you can see where to go. Pause. Look at the folds. Look at the folds. Now, take the hint. No. 4 o'clock. Good man. Let it come round. Let it come round. There. Now, don't advance. You're desperate to advance. You're desperate. Tip up. Tip up. That's it. Keep it going. Keep it going. On, off. On, off, on, off. There you go. Now you can see where to go. See it? We're still in the same place. Stop. Right. Let's just stand there for a second. Just stand here.
Yeah.
Where I am.
Mm-hmm.
Just stand there. Let's tidy up this for you, so it feels less cumbersome. Right. Friend. So, that's the lumen. Yeah. Where do you need to go?
9 o'clock.
9 o'clock. Right. What you need to do for 9 o'clock is this.
Anti-clockwise.
anti-clockwise. So the button's now facing the floor.
Okay.
Right? Advance the scope a centimetre. Tip up so you go over that fold. Anti-clockwise now. Draw the scope back. You're under the fold. And just take the tip up again. Tip up. And you're under that fold. Just take the tip up again and down. So what you're trying to do is push that fold up and around. What we're trying to do is get you to do that.
Yes.
So what happens when you actually pull the tip back? What happens is if that hold your hand like this, no, like this, so that's like this. That's the lumen.
Yes.
We want tip up. It shortens.
Okay.
We're catching this fold here, and that's what's happening.
So
I've allowed it to come back, and the tip is done here, and I
Okay.
allowed it to shorten because that's what I wanted it to do. Yeah? And what you were trying to do was push it round, and what I'm trying to get you to do is slowly pass it round. Look, see the folds? See the fold here in front of you?
Yes. Yes.
Tip up. Use the scope. Use the force, Luke. Tip up. Shorten. In. Out. Ah. Oof. Tell me what you're doing.
I'm just forwarding the scope. And,
Good man. And steady. Excellent. Once you're slowing it down, you've got more control. Now you're slowing it down, more control. Keep going forward. Keep going forward. You're going forward and now you keep pulling it back. You're frightened. What you've got is a little bit of resistance.
yes.
Okay? Try that.
The listener is slightly increased, but it's still empty in the resistance.
Okay. Keep going nicely. If it's not working, then what can we do?
We could withdraw.
We could withdraw, we could stop the test even.
No, two things.
Right, you've tried this a couple of times. What else could we do to open up this?
We can inflate with the.
We could inflate, but we showed you what that happened to the mannequin. So what else can we do?
We can change the posture.
We could change the position. Do you think that'll help?
Maybe.
Maybe, okay.
But actually,
Let's change the position and see how it goes. Come onto your back, my friend.
थोड़ा सीधा हो जाए बेटा.
Keep the, don't you do anything. Just don't you do anything. Keep your eye on the screen. Keep the lumen central. Keep the lumen central. Good. Good. Now, your shoulder. Let the advance nice and slowly. Let's just make sure this is pointing in the right direction.
it's not advancing.
Okay, let me show you. You've done good. Just stand there a second. There we go. Right. If you look at the screen there, I'm going to take this out now. That's here. If you look on the screen that's on there, you'll see that what it wants to do is go forward. And the way it wants to go forward is by drawing back. If you remember when we were talking about on the mannequin, once you've changed position, you should draw back. What you did was,
Yes.
is that you didn't draw back, you just tried to advance.
Right.
And as a result of that, it stayed the same and you were just causing the same issues. So you have to draw back. All right? So now we're here, draw back, and now, don't want to drop back too far, but we may do if we're not careful. And just let the scope come back. You got your little wheel locked. That then causes problems. A lot of air there, so we're taking the air down. Okay, pop that back in. Now allow the scope just to go forward and round. Anti and clockwise. Anti and then let the scope come back. And now let it go forward. Now you can see where it wants to be. You'd probably want to advance it at this point. I don't. I take the scope back. I let the scope go there and I let the clockwise torque come in. Just a little bit. And let the scope come back. Can you see the folds themselves? Okay, so now we're here. I look and see how to actually get round. If I actually went this way, it'll go. So I turn it. Turn my shoulder. Yeah? Suck. Turn your shoulder. Suck. Draw the scope back. Allow the scope to go forward. Again, turn the scope anti-clockwise. Let the scope relax and let the scope sit there. Come back. See the folds. See what they're doing. Where do you think the lumen is?
At 12 o'clock.
More up to 11.
Yes. 11.
See? So it's situated at 11. Suck, 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 suck. More suck. So, and what you've done is that you'd fell foul of putting too much air in. Okay? You need a little bit of air, but then you were sitting on the air and causing problems. The bubbles that you get is the bowel prep accompanied with the too much air. So now we point the scope up to 12 o'clock. See it at 12. We keep it at 12. Keep it at 12. Keep it at 12. Now the bowels just step towards us. Draw back. Advance. Okay. We just advance just a fraction. A bit more. A bit more. And let the tip of the scope go down. See the tip? I sit the scope here. I allow the scope to sit. See the scope itself? Now I let the scope come back in a straight line. If you look at this, that's suggesting that you should be very close to the cecum. Right? With that being the case, we look and we see, we bring the scope back, and I say to myself, well, if that's in the cecum, if I was to do this, that should show it a little bit easier. So the scope is relaxed, we clean the lens and come back. Now where do you think the lumen is?
11 or 10, something
Okay.
around.
The little wheel is neutral.
Yeah.
See that?
Yeah.
Make sure, and there. So I'm looking, where's the lumen?
Again, at 6 o'clock.
No. Watch that, see this teeny alpha, see it? As you,
Again, 11, 10 and 11.
yeah, see it? So what you're doing, you know what you want to do, but you're reading the signs not correctly at the moment. So look at the folds. Where are we? What's that?
Pick up.
Okay. So we come back a fraction. This is a guy who's got melena, yeah?
Yes.
So we come back and we have a look. Take some air down, air down, air down. And if you look at this, that thing's dancing. And there's the IC valve. Can you see it? Now the IC valve is just straight here to the side. There. See it?
Yes.
So is that the IC or is that the appendix? Right, so we need to biopsy that.
Yes.
Now some biopsies please, my friend. So right, go back onto your side. Not yet, boss. Yeah. I'm just blowing water in at the moment. So I would take some little samples from there.
Okay.
Don't move the scope, just take the biopsies. Don't move the scope, just take the biopsies. Yes, please. How you doing? Yeah, yeah. Good. Now, did you see how that mucosa just fell away? So it's not really that swollen, even though it's slightly red. Got a little bit of metaplasia, but nothing untoward. Everything looks okay. Keep your eye on the screen. That's it, that's it. Excellent. Now come back and have a look at the appendix again. So that's enough there now, Eric, matey. That's good. Take your right hand off the scope. Take your right hand off the wheel. That's good. And suck. And suck. Suck. Good. Turn yourself back this way. Good. And go in. Advance. Look at what you're doing with the scope. That's good. Go on. Go on. Go forward. I need to have a look at the appendix again. Suck. That's enough. Tip down. Just clean your lens. It looks okay now. It looks fine. It's okay. That's great.
Close correct?
Not inside, just on the edge. Not inside it, just on the edge. Otherwise you'll be visiting a surgeon. Relax. Good man. That's good, it's straight in front of you. That area is straight in front of you. So we don't need many bites, just one.
One more.
Yeah, one will be fine. That's it. Good. Good. Excellent. And now start taking the tube out, my friend. Take the tube out nice and slow. Nice and slow. Nice and slow. Nice and slow.
No biopsy? Only one?
Just one.
Okay.
It's the appendix. If you take more, you'll be visiting a surgeon. It looks normal.
Yes, yes.
Yeah. So we don't need to do anything else. There's nothing to suggest carcinoid or anything like this. Ooh. Ooh. I see appendix orifice. Turn your shoulder, man. Turn your shoulder. Turn your shoulder. Big wheel forward. Turn your shoulder. Turn your shoulder. That's it. Go back in. 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 That's fine. Clean your lens and start to come out again. Good man. Good. Turn your shoulder. Anti. Great. Great. Big wheel forward. That's great. Clockwise. Slowly. Good man. Anti. 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 The other way. That's it. Too much? Good. 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 Slowly, little bit of air. Little bit of air. That's cleaning your lens, little bit of air. Suck. Right, a little bit of air, good. Turn. Man, you're in a very awkward position. Yeah. Little bit of air. Stop. Good. Air. Oh, thank you. See it? So what a little bit of air, you're doing is that you're on, you're off, you're on, you're off. No, slow. Slow. Slow, 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 slow. See? Slow, 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 slow. Slow, 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 slow. Slow, 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 slow. Yeah? Yeah? See how slow?
Isn't it white patches over there? No?
No?
Okay.
Slow, 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 slow. Okay? Yeah? Back on the bed with the scope. Back on the bed with the scope. Okay. Get this so it's straight. His feet. That's good. Right. Stop. Relax. Okay. Back here. Now, we're virtually out. Let him know what you're going to do. You're going to make the scope look back on itself. It's going to be uncomfortable. Let him know.
Okay. हम आपके ये ट्यूब जो है वो निकाल रहे हैं ठीक है ये प्रोसीजर खत्म हो गया
Okay. Slowly draw the big wheel back. That's it. No, the other way. Advance. Slowly advance. Go on, advance. Slowly, man. Big wheel all the way back. You advance. Put a torque on. Clean your lens. Keep the torque on. Don't suck. Right. And now, with this hand,
yes
little wheel back. 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 That's it. This thumb, lock them in position. That there, advance. There's the scope.
okay
Advance just another centimetre. That's fine. Can you see there?
yes right
It's hemorrhoids.
yes
Okay. Right, let the wheels go. Let the scope relax. Let the wheels go. Let them return to neutral if possible. And slowly draw the scope back. And slowly draw the slope. Keep your eye on the screen. Clean your lens. Clean your lens. Good. Centralise your image. That's it. Fine. Well done. Well done. Well done. Well done. Well done.